Letting go of a loved one is never an easy process. Hospice care combines the efforts of doctors, nurses, counselors, and other caregivers to help families navigate those troubled waters. Most of the time, hospice care occurs in the home or in a specially prepared area of a hospital. Now there's a new place for families to get that care. The Baptist Trinity Hospice House recently opened on the campus of Baptist Memorial Hospital, Collierville. Rod Starnes has details.
They gathered on a sunny morning in Collierville to dedicate a special new home. Surrounded by trees, a welcoming fountain outside the front doors. The dedication ceremony was for the Baptist Trinity Hospice House, the first residential hospice in the Memphis area. According to Baptist Trinity's administrator, it will serve an important purpose.
And then there will be an individual who is facing their journey's end, and they will be our first patient. They will have received some news that there is no longer an option for cure for them, and they will have made the decision to focus on living, but for a variety of different reasons, they cannot do that at home, and they will need a place to go. And we will be here for them to welcome them and to embrace them and to comfort them and their family and provide a haven for them. And we will provide hope and healing for their families through the Kimmons Wilson Family Center for Good Grief. This will be a special place.
Hospice care is the process of caring for people who will die soon. It is designed to help people, both patients and their families, deal with that sobering news. Caregivers often come to patients' homes. The care is also offered in specially outfitted areas of hospitals. Area Attorney Ed McKinney lost both of his parents and an uncle to cancer. He says the hospice care provided by Baptist Trinity was a big help to his family throughout the process.
Death is traumatic, and people react to it differently. You don't know how anyone's going to react until it happens to your family. With my dad, he tended to internalize and not say too much. And that was my first interaction with hospice. And he didn't really want to know much about the process. But the hospice people helped us by telling us what to expect and when to expect it. And then towards the end, he did want to know a little bit, and I was able to help him by kind of walking him through what the process was from what they had told me.
When McKinney's mother received hospice care, she wanted as much information as possible. During the years she was in the program, the Baptist Trinity caregivers ended up being much more than professionals providing medical care and counseling.
And they became very friendly. In fact, when she died, they came to the funeral, which impressed me to no end. But they gave her a comfort level, which was invaluable.
The new 24-bed center will officially open after receiving state certification. Terminally ill patients will be able to get acute care level treatment in a home-like atmosphere. Planners say the specially trained staff will be available around the clock to help patients and their loved ones through what can be a difficult time. For Smart Medicine, I'm Rod Starnes.